Yeah, so I obtained my GP fellowship in 2006, so a little while ago now. So years have gone by quickly, so plenty of experience within general practice. So predominantly, I've been working as a GP at a clinic called Life Medical Waterloo, and also do some work at Malabar Medical Centre as well. And I split about 70% at Waterloo and 30% at Malabar. On top of the clinical work, the other thing I like to do is I extremely enjoy supervising some of the younger GP registrars coming through. And in terms of demographics, so we see the whole spectrum of illnesses. GPs are in a pretty good position to provide smoking cessation advice overall. So that's with patients with a cancer diagnosis, or patients without a cancer diagnosis and other comorbidities, etc. And I think because of the nature of the continuity of care, I would like to think that we're not everyone's cup of tea. You don't get along with every single patient, but I think if you genuinely care for the patient, you have a good relationship with the patient, and that therapeutic relationship is robust, it just allows us to be in a good position to talk about smoking cessation, and particularly in the context of patients who have a diagnosis of cancer. I think we're in a good position. We have more leverage, and there's more impetus for the patient to consider smoking cessation or consider reduction. And hopefully in the context of good continuity of care, a good therapeutic relationship with the patient, we're in a good position to have that conversation, encourage, support, and challenge a patient to reduce tobacco use, or even better, completely cease tobacco use. When patients have a diagnosis of cancer, it's something that significantly impacts upon their life, both physically, psychologically as well. And I think we're in a good position. There are a lot of patients with a diagnosis of cancer, particularly if it's something that has a very, very good prognosis. And most patients are intelligent enough to know that smoking cessation will certainly improve outcomes, and that's when we need to strike while the iron's hot, and that's when we're in a good position to initiate change in that particular patient. So they're probably more so in the contemplative phase, or the ready for action phase, and it does make it much easier when there is a significant diagnosis that affects their lifestyle and causes significant morbidity, for them to make some change, particularly with cancers whereby the diagnosis is early and the patient knows that they're in a good position to essentially prevent worsening or progression of the cancer by smoking, by ceasing smoking. And there's all the other benefits as well of smoking cessation, but I think primarily for a patient with a cancer diagnosis, it's what can I do to ensure that I don't contribute to the progression of this particular cancer. You get the typical, very cliche responses like, "Look, Jimmy, I've lived a pretty good life. I'm 75 now. I've lived a good life. I've smoked my whole life. Why would I want to, stop smoking now?" So, there are some patients who, have that mindset, but it's about slowly chipping away, and with the continuity, the follow-up progress consultations, we just chip away every single time. If there can be a system whereby the letters can come out to GPs swiftly, it's extremely beneficial for us. And it's all about, I think in general practice, it's all about holistic care. So we need to know what treatment the patient is on, duration of treatment, and I guess most importantly, what are some of the potential side effects to look out for, with a cancer treatment that the patient is having. Because the duration of treatment and the side effects, that has an impact on the patient physically, but also psychologically. And psychologically, they need to be ready to cease smoking, or at least reduce the amount of tobacco use that they're having. And so I guess having a correspondence letter that talks about the medications the patient's on, what side effects are we expecting with this particular patient, morbidity, prognosis, all that contributes to, I guess, the holistic assessment of the patient, and that then helps us. We know what the patient's going through. We know what potential side effects to look out for, and we therefore know, the potential issues that the patient might have with initiating pharmacotherapy for smoking cessation. So if they're getting a lot of side effects already with the treatment, and Champix, for example, has more side effects, it's good to know, what their baseline is in terms of their cancer treatment, so that we're aware and can empathise what they're going through, and then counsel accordingly with another potential medication that they're going to take. Side effects as well of the treatment, interactions is pretty important. So, as GPs, obviously we don't deal with any of the oncology drugs on a regular basis. So, awareness of potential interactions is important for us, so that when we do prescribe smoking cessation medication, we're aware that there is a potential interaction with, the chemotherapy or whatever treatment that they're on. In a nutshell, handouts are useful. Patients aren't the most reliable in terms of bringing information back to us because of various factors, as I've mentioned. The email system's pretty suboptimal. Faxes generally work, dinosaur technology, but all we need is something very general, something simple, just with a patient's name on there, attention to the GP. That will be useful. Depending on the practice, how everything works. I mean, my practice is generally pretty efficient at getting correspondence scanned in. Doctor sees the correspondence, doctor ticks it off and gets scanned into the file. So that hopefully when the patient sees the GP, all the information's there. So we've got, some information on the chemotherapy agents that they're on, and any potential side effects and interactions with smoking cessation medications. It's already there. I suppose if there are any other medications that aren't available for GPs, that can be used for smoking cessation. So in other words, if there's any trials that the oncologists are running, with regards to newer smoking cessation medication in the context of a specific type of cancer, that would be useful. But in terms of the pharmacotherapy and also the counselling, I think most of us are pretty happy with, I guess, the arsenal of medications that we have in terms of treatment. So if there's any newer products available, or any new trials where there's a specific trial for a new drug for smoking cessation, that would be extremely beneficial. What would be useful would be ease of access to specialists. I must say the majority of specialists are extremely helpful. If the GP has a query, usually they're contactable. If the staff specialist isn't contactable, normally the registrar is contactable. So the specialists really can't fault them. They're there to help, and we can get help from them. I was just thinking perhaps another option we have, because the specialists are extremely busy, the registrars are busy, the staff specialists are busy. Another option would perhaps be an oncology nurse who is trained up to give simple advice. And GPs just require simple advice, where when I'm a specialist, we need things to be nice and simple for us. And so, and obviously I understand that oncology nurses are very, very busy as well. But if there is, for example, an oncology nurse that's able to provide very quick advice related to the context of what we talked about today, and just standard advice, that would be useful. Often I find it's much easier, getting in contact with a nursing unit specialist. Sometimes, given how busy the oncologists are, and we don't want to bother the oncologist and the oncology registrar for very simple things as well. They're out there making big decisions with complex medications and a ward full of patients who are immunocompromised and all the rest of it. And often the questions we have are very simple questions. So if there's some sort of avenue, whereby if it is a little bit easier for an oncology nurse to be available and answer some of those simple questions, and obviously if they can't answer those questions, then we can be referred on. I think a cohesive approach is key. So I'm happy to prescribe the drugs. If the specialist initiates, that's wonderful. I can follow up as well. So it's all about a cohesive approach. So if all the practitioners are saying the same thing, then the patient is much more likely to consider treatment. Yeah, so more than happy for specialists or their team to initiate treatment, and then we as GPs can then follow up the treatment and continue that treatment. And look, a lot of patients there's a lot of respect for specialists. There's an immense respect for specialists because they're experts in the craft, and so if a specialist says one thing, the majority of patients would take heed of the warning. So we're happy to continue on with the treatment. So the specialists, if they're happy to do some in the context of obviously they're busy outpatients, if they're happy for some brief intervention, we're more than happy to follow through. So a cohesive approach where the medical team is saying the same thing with regard to smoking cessation, I'm sure will lead to better outcomes.